Hello, welcome. I'm going to do it in tandem today again in terms of TikTok and YouTube Live together. Hmm, Let me see this. TikTok. I have a live that I've scheduled for today. Um, just go live there now. Oh, I couldn't put all the characters that I wanted to do. So we did that like the last time that we did the live. Hopefully, I can move this way, move it away from the door just in case the children decide to come in. Um, yeah, welcome to my live, everybody. I need to, I'm trying to type, but I don't think that's the best way to do it. So, welcome, everybody. Welcome to my live. I think this will be good. I have some people actually even need to call. Oh my goodness. I've been so busy. Been so busy. Um I need to call some people today. Okay. I need to send somebody this as well. Oh Lord. Welcome everybody. Welcome to my live. Ask your questions in the chat. Ask your questions in the chat. Welcome to the live. Welcome. We'll be going through some interview questions and answers. Let me see some questions and answers that we'll go through. Mm, Hi, welcome everybody. We're just going to be talking about some interview questions and answers for any band, really. I'll try and do some band questions as well. We'll do band three questions today. Hi, welcome. Hi, Joy. I'm sorry. I don't really accept people I don't have previous interactions with to join to co-hosts. I'm sorry. Um, so if we're ready, if you have any questions, just ask quickly. I'm going to be doing some band three NHS questions and answers. I'm just trying to get into my laptop, to my work laptop, to do the band three questions and answers. So I really want you to just stay around and oh, thank you so much, Benel. Oh, thank you so much. I appreciate it. I do try. I do really try. Oh, thank you for the likes as well. Thanks, Bemi, for liking the live. I want you to just send it round, send it to people, invite other people to kind of join this live. I'm going to try and do like a quick one because I'm really trying to remain consistent in terms of me coming on live. I need to try and remain consistent to come on live to try and impact a bit of wisdom on people with regards to questions and answers, real life questions and answers. Oh, thank you for liking the live as well and on YouTube. I really appreciate it. Please send the live to people as well on YouTube for them to be able to join and yeah and watch. Yeah. So I'm doing like a concurrent one in terms of YouTube and TikTok so I can get maximize the value in a sense. So I wanted to run through quickly some interview prep. I actually have a client that I'm meant to be speaking to at 7. We're going to be going through some interview prep. She has an interview next week. So I wanted to do like a live for it, but I just realized that I wouldn't have time to do like a live session with her because I wanted you to see the value of what I do in terms I was going to ask her if we could do it on live. But because I don't think my husband is going to play badminton, so he wouldn't be able to look after the kids while I'm on live. Hence the reason why I'm having to move it forward here. So please spread the love and the like in terms of the hearts and all that. Please, please, please share the live. So I'm gonna go run through some band three NHS healthcare assistant healthcare assistants interview questions and answers. So like I said previously, band threes are questions to do with scenario based questions that they'll be asking you during the interview. There will be scenario based questions that they'll be asking during the interview. So one of the questions that normally come out is give us an example of when you provided excellent patient care. How would you say this for the interviewer during an interview? What I always say to people is just to bring out the STAR method. That's the situation, task, action, and results. With regards to that answer for you. So one of the ways I would answer that one would be, oh, thank you, Debbie, for liking the live. I appreciate it. I appreciate it. Thank you so much. And Esteri Ayaba, thank you so much. Oh, thanks for joining. Yeah, thanks for coming. So one of the answers to that question is how will you answer this? Give us an example of when you provided excellent patient care. So you talk about the situation is like when you were working in a busy ward, I was caring for an elderly patient who was anxious about a planned procedure. Okay. What task did you perform for that patient? My role was to perform my role was to provide reassurance, ensure comfort, and help prepare the patient for the theater. So, for the procedure that the patient was going to be going for, your job was to help them prepare that. So, your action for that one is that you sat with the patient, explain what would happen step by step in simple and plain English language. I offered them a cup of tea because we British, we love our tea and kept checking back while balancing other patients. So that's your multitasking skills as well that you are showing up, that you are showing to the interviewer. Okay. I also escalated any concerns to the nurse in charge so that consultants could explain further to the patient. So these are the steps of what you've actually taken, your actions of what you've actually taken to ensure that I was about to say employee, I've been talking about employee too much today. To ensure that the patient is comfortable and well looked after. The result was that the patient became visibly calmer, thanked me for taking the time, and went to the theater reassured that the procedure was going to go well. The nurse in charge praised me for my compassionate approach. So I think put yourself in the situation of that patient. This is about showing that you can provide excellent patient care. It's about your caring, it's about your compassion, your empathy, your communication skills, your teamwork. Those are all the things that you've mentioned in that answer. Those are all the things you've mentioned in that answer, whether you actually like it or not. Because when you're saying all those things, it gives them reassurance that okay, this person is not just thinking about themselves, this person is thinking about other patients as well. So I'm just trying to make sure that I haven't missed anybody's questions that have joined the live. No one has asked any questions yet. So we're just running through a band three interview questions and answers for a healthcare assistant. Okay, so that's what we're gonna do today. This is just a sample interview question and answer for a band three healthcare assistant. So the first question we went through today was, can you give me an example of when you provided excellent patient care? That is what we want to hear about team working, about compassionate care, about communication skills, about your empathy, about knowledge, about teamwork. Those are the things that we want to hear today. Sorry, those are the things that we want to hear during the interview. So that's the first question. So another common question is, tell me a time you worked well as part of a team. Team working is very essential no matter what level you're on. From level one or level two, I think I don't even think they've scrapped level and band one now. So from band two to band nine, team working is an essential part of working within the NHS. So the next question that we normally ask is, tell me a time you worked well as part of a team. So this one, they really want to hear about your collaboration, your teamwork, and your communication skill, your ability to balance different priorities. Those are the kind of things that they want to hear when you are giving them. What's it? Okay. Sorry, I'm just trying to read the comments as well. So these are the kind of things that they want to hear when you're answering this question. So tell us about a time you worked well as part of a team. On a shift when the ward was short staffed, we had several patients needing personal care and observation. The team needed to divide tasks efficiently to ensure safe and timely care. I communicated with colleagues, volunteered to do observations and help feeding while keeping an eye on fluid balance charts. I also checked in with the team regularly and supported colleagues who were struggling. All patients received timely care, the shift ran smoothly despite the pressures, and the nurse in charge thanked us for working well together under pressure. The reason I'm having to read all these prepared answers is because this is not my normal role. But when I'm sitting at that interview panel on the other side, I know what I'm expecting to hear. So these are the kind of things I would want to hear from you. What we've talked about in this skin is about the pressures that you were facing on that day. So you need to be able to say how you worked part of the team, your collaboration, working with the multidisciplinary team, your task prioritization. So prioritizing your work, team working, communication skill, what's it called? Working together, um, ensuring that all tasks are being completed, and when you needed to escalate, you escalate as well, because as a band three you don't really have much powers to be able to do things yourself, and you don't have the powers to be able to kind of take decisions by yourself. So you will still need decisions from senior nurses to be able to what's it called, to be able to take those decisions for you. Or Tochima, thank you. Oh, I'm so happy that I'm able to help you. Yeah. So just listen to the answers of what the interviewer wants to hear. We'll be going through a couple of questions today. So I'm hoping that some of these questions would come out during your interview, because these are like common questions that are asked for band threes. Okay. Another question that normally comes out is, describe a time you dealt with a challenging patient or relative. If you work in a busy ward, have you been to the hospital? People are always complaining. People are always people are always complaining. People are always trying to get information. People are anxious. People are scared. It's a very scary place, especially when you have a loved one in there and you don't understand what is going on. So those kind of thing brings out sometimes not the really nice side from about people. It kind of brings out the other side of people, but we need to try and understand that that is, in most cases, not always, in most cases, that's not that who that person is because of what they're actually going through at that point in time that is causing them to behave the way they behave. So if they ask you this kind of question, they want to know how you're going to handle kind of working with hi blessing. They're just trying to understand how you're going to handle those kind of situations. So describe a time you dealt with a challenging patient or relative. So you see the answer in terms of a relative was upset that the loved one has not been reviewed by the doctor and voiced the frustration to me. My task was to remain professional, de-escalate the situation, and ensure that their concerns were heard. I listened without interrupting, acknowledged their worries, and reassured them I would escalate. I then calmly explained the doctor's workload and gave them an estimated time frame while also updating the nurse in charge. The relative thanked me and listened and felt reassured. The situation de escalated and the patient was reviewed shortly after. Although my although my answers are quite short, Although my answers are quite short, you can always flesh it out a bit more in terms of um this is what happened. I got up, I went to speak to the nurse in charge. I asked her what the updates was. I wrote down the updates in my notes so I don't forget all the vital information that I've asked for. Then I went back to the person to let them know by reading out the notes and ensuring that I ensuring that ensuring that what's it called I was able to answer their questions properly. So those are kind of ways you can maybe flesh it out a bit more for them to be able to see that you actually know what you're talking about. You've actually done that kind of role before. Yeah. Let me just see. I'm not missing anybody's questions because I was in my rant there. I don't think I've missed anybody's questions. Hi, Blessing. Thank you so much. I appreciate you. Yeah. So another question is, can you tell us about the time you use your own initiative? Using your own initiative is really, really necessary, especially when you're under pressure, especially when you're in a very busy team. When it's so chaotic, depending on the kind of department you're working in, most times there's always peaks and troughs of peak periods within the day. So you need to ensure that you're able to use your initiative to be able to deal with certain aspects of the job. So if you are being asked, tell us a situation where you use your own initiative. On a shift, I noticed a patient with dementia appeared more agitated than usual and was repeatedly trying to get out of bed. I needed to ensure their safety while avoiding unnecessary distress. I redirected their attention with a calming activity, ensured the cobble was within reach, and updated the nurse about the change in behavior. The patient settled, reducing the risk of a fall. The nurse recommended me for noticing early signs of agitation and acting quickly. Also, another time that you used your initiative was when maybe there was water poured on the floor. Even though it's not your role as an HCA to clean spills and all that, you need a potter and all that to be able to demarcate the area and all that. You say you guarded the old area, you went ahead to get the buckets, you cleaned it in time so that you avoided spills. I mean, you avoided slips and falls because of the high traffic area in that place. And as a result of that, no one was injured during your work during that day at work. So looking for real life example, what can you say that you've used your own initiative to do? Maybe attending to a patient that needed help or that needed instructions or giving directions to someone or explaining the situation based on what you know about their case. So using your initiative and just okay, I'm trying to kind of de-escalate the situation of what's going on here. Let me try and make sure that on top of things. That's what it's really about. Yeah, so yeah, ensuring that that is done properly. So another question, I'm speeding through this because no one is asking questions. I think my little boy wants to come in. My little boy wants to come in. Oh my goodness, such a cutie. I haven't seen him all day, but because I want to stay consistent with TikTok Live and also YouTube Live, I'm trying to ensure that I'm fitting it in as much as possible. Hence the reason why I'm going to quickly do this now for about an hour maximum, really, and then I would go and attend to him. Yeah. So another question. Um, I'm just typing on YouTube. Um, oh, I actually even have a meeting. Actually, oh Lord, I'm not setting my priorities properly. Oh my goodness. Um, I probably need to attend this meeting. I just realized I've rescheduled. Oh, your interview is for a band 5 mental health nurse. Okay. Okay, let's see. Can we do band 5 mental health nurse questions and answers quickly? Let's see. I'm trying to look at um my my what's it called? Because I have actually, I'm going to be interviewing for a mental health nurse tomorrow actually. And I don't yet have the questions. That's just the funny. That's the thing. But I don't think I would even give out the questions here, even if I had the questions today. Maybe tomorrow after the interview, I would always say the questions, but not before not before the interview. But anyways, I don't even have the questions. So Touchy Mary, what's it called? Touchy Mary, you have band 5 interview tomorrow. I wish you all the best. I wish you all the best with your interview tomorrow. Okay. Oh, is it Monday? I thought I just saw something here. Was he? You have it on Monday or tomorrow? Oh, your Monday. Okay. You can use these questions to kind of prep. If you go onto my YouTube channel, you will see the questions and answers from today's session on there. So you can go back there and watch it and hear the answers I give. So go onto my YouTube channel. The link to my YouTube channel is on my profile. If you click on my profile, it will take you directly to my YouTube channel. Please, guys, go and subscribe to my channel. Go and watch my videos. I want to monetize my YouTube channel. So please, please, please go onto my YouTube channel and binge watch my videos, please. Thank you so much. I appreciate it. Okay, so we're going to do a couple of questions for band 5 because I actually have a meeting at 6:30 that it just popped up on my calendar now. That's why I use my calendar for everything. I've been what's it called? I'll see if I can go for the meeting quickly. Hopefully I'll be able to kind of tell the person I would reschedule because I've been missing this meeting for a bit. This person has been trying to nail me down for a bit. So I need to ensure that I go. Okay, let me stop talking. For your interview on Monday, tell me a time. Do you want to come up and um hold on, who's that? Touchy Mary Ann, do you want to come up quickly and what's it called, and answer a question for me, and I'll give you a score? Do you want to do that? Let me know quickly so I would invite you, and you tell me the answer. How do you do it? Request to come up, touching Mary Ann. Request to come up. Oh, I don't know how to do this. Okay, I think I can do it. So I've invited you to try and come up. So we'll quickly go through a question now. Oh, okay, in a nursery environment. Okay, that's fine. I would have loved for you to kind of give me your answer so I could let you know how I would rate you or how I would score you if you were sitting in front of me as on during an interview. But that's fine. I would say this answer. Okay, tell me a time you manage a challenging patient's behavior because you're a mental health nurse. So like I said, I have a mental health interview tomorrow where I'm on the panel. So what we're looking for here is while working as an HCA on an acute mental health ward, a patient became verbally aggressive after being refused leave. I needed to de-escalate the situation safely while ensuring the patient and others remained unharmed. I used a calm non-confrontational tone, gave the patient space and acknowledged their feelings. I applied de-escalation techniques I had been trained in and offered them choices to regain a sense of control. I also alerted a colleague discreetly in case extra support was needed. The patient calmed down within minutes and later thanked me for listening. The situation was managed without restraint, and the staff safety was maintained. Sorry, my eye. I have this infection in my eye that is bothering me. Sorry about that. Yeah. So Let me look for another one. Hmm. Let me look for another one. I'm just looking through my questions and answers. Mm, describe a time you worked effectively in a multidisciplinary team. So the answer would to this one would be during placement. I joined a care planning meeting for a patient with schizophrenia. I'm sure I didn't say that properly. My task was to contribute observations about daily engagement. I shared examples of progress, listened to colleagues, and ensured the patient's perspective was included. A holistic care plan was created, improving engagement and outcome. I'm not really enjoying the way I'm saying these answers because I needed to be a bit more in depth when I'm giving the answers to these questions. I'm just trying to see another question I have for a band 5 mental health nurse. Tell us a time where you advocated for a patient. I'm not even reading all my comments. I'm hoping I haven't missed anybody's questions. I'm hoping I haven't missed anybody's questions. I don't think I have. Um, tell us a time you advocated for a patient. Because you're a mental health nurse, the patients in most cases they can't advocate for themselves, or they don't have the mental capacity to be able to explain how they're feeling and what they need. So, in this kind of situation, you would say a patient expressed that they felt unheard regarding side effects of their medication. I needed to ensure that their concerns were communicated appropriately to the nursing team. I listened attentively, validated their experience, and documented their concerns clearly. I raised this issue during handover and ensured it was flagged to the nurse in charge. The doctor reviewed the medication and an alternative was considered. The patients felt respected and became more engaged with their treatment. Because if you're not engaging them or if you're not listening to patients, it's they don't feel engaged. They would even probably make a turn for the worse, do not want to engage with the services that you're meant to be offering to them. So in all that kind of situation, you need to ensure that the patient is always at the center of what you're meant to do. Okay, I hope those questions were good. Um, oh my goodness. Okay. Sorry about that. You need to respect their individuality. You need to value their choices that they've made. Um, what's it called? You need to value their choices that they've made. You need to also look at about working collaboratively with them as well. Just not just the patients, their family members, their multidisciplinary team, and also look to promote what's it called the recovery as well. So that's what the essence of it is about, working with them to ensure that they are better than when you started looking after them. So that's what it means. So with that, I think there's a question that we would probably ask you around patient-centered care, because of the mental health um, team you're going to be going into. You need to be able to show them that you're putting the patient first. So, can you give me an example of delivering patient centered care in practice? So, you can give an answer of on an acute ward, I worked with a patient who was reluctant to attend ward rounds. I needed to support them to have their voice heard in their care planning. I spent time listening to their concern, reassured them about the process, and asked them what they wanted the staff to know. I offered to sit down with them during the meeting and supported them to speak when they felt ready. The patient contributed to their plan, they felt listened to, and their confidence grew in engaging with the team. Yeah, I'm meant to be going into a meeting now. Oh my goodness. So I hope that one has been able to you've been able to what's it called? Get a good answer to a patient-centered care, because at the end of the day the patient was at the heart of what you were doing. Just bear with me one moment. Just gonna take a short pause for a minute and just try and see if I can change my meeting time. quicker than I thought. Um, yes, so I'm back. Yes, I'm back. Okay, sorry for that. 5 minutes intermission. Um, oh, I don't know what happened there. I think I went on pause for too long. Then TikTok is saying something. I don't know what it's saying. Oh Lord. Okay. Tochi Mary Ann. Was that okay in terms of the questions and answer that we went through? Was that okay for you? Let me know if that was okay, or if you want more questions and answers. Mhm. Was that okay? Does anybody have any questions? I actually need to make some phone calls today. Oh, thank you so much. Thanks for the hearts. Appreciate it. Um, um, let me know. Let me know if you have any questions on here. Oh, thank you so much, Touchy Marianne. Yeah. If you need more questions answered, let me know, and I'll be able to answer your questions. Oh, thank you so much. Thanks for liking the live. I don't know what's going on with TikTok. Yeah, yeah. Does anyone have any questions? I don't derive value in just sitting here. I have so much stuff to do. I don't derive value in just sitting here and just whiling away time if no one has questions with regards to anything to do with the NHS. If you don't have any questions with regards to the NHS, I think we can just leave. Hmm? Does anyone have any questions? Can you tell? I should have done that actually. I'm HR Ali. I've worked in HR for the last 20 years, focusing more on the NHS in the last 10 years. I have over 10 years experience working within NHS. I work in HR, so I've done roles from all HR generalist roles from HR assistant, HR coordinator, HR business partner, HR advisor, HR recruitment business partner, change management, transformation lead. So I've kind of have different experiences in almost every aspect of HR. I think apart from learning and development, I've not really touched into going into. But every other thing, even organizational development, I've done a bit of a stint there as well. So I have vast experience. So from looking after your employees from start to finish, from sending out recruitment, what's it called? Posting the job on the recruitment dashboard, to inviting you for interview, to shortlisting you, to sitting on the panel. I've done all that. To assigning the people that are going to get the job, I've done all that. To HR bits of onboarding, sending you your contract, ensuring that the contract is the correct contract. I'm coming, put him down. Yeah. Thank you so much. Ensuring that is the right contract, ensuring that you know your rights in the organization, from knowledge base to listening to you, change management, um, just culture. I do a lot of disciplinaries, grievances, bullying and harassment. I've been to the tribunal a couple of times, which was really fun. I had to sit there and answer those questions from that judge. It was not fun at all. So to doing all that, so I have vast experience in name it within HR, I do it. So, but in the last 10 years, I've focused more on working within the NHS and I've built my career within the NHS. So everything to do with recruiting, I know. Anything to do with shortlisting, I know. Anything to do with interviewing, I know. Like I said, I regularly sit on interview panel. Tomorrow I'm going to be on an interview panel for a band 5 mental health nurse. Next week we're doing a group. What did she send to me? Was it a group? Where's the email? I just looked at it today. I'm just trying to check my email to see what she said, what she called it. It's a where is she? Where is she? I'm looking at my emails. It's a group interview. That was what she called it. So we're going to do like a speed dating kind of thing. So we're doing a group interview tomorrow. So in that group interview, it would look like they would arrive, a group scenario question. Then we'll now do one-to-one interview. Then we'll now have a tour of where we're going to be working. Then that's the end of the day. So yeah. So that's going to be fun. I'm actually looking forward to that. I haven't done that in a while, that group interview, and we're expecting about 6 people for that interview. So that's going to be fun. And I'm going to come back and tell you guys how that went. So yeah, so I'm looking forward to that group one next week. That's next week, sometime next week anyways. So I'll let you guys know once I finish that interview and how it went on that day. Yeah, and tomorrow's interview again, I'll let you guys know how tomorrow's interview went. Like I said, it's for a mental health nurse band 5. So yeah, that's going to be fun for me tomorrow and next week when I do the other interview as well. So I'm looking forward to that. Is there any other question? So I hope that's giving you a bit of an example of me in terms of I hope that's giving you a bit of more insight into me and in terms of my experiences and qualification. Thank you so much, Low Fashion X. Thank you so much. Thanks everyone that's come onto the live and liked it and all that. So Tochi and he said, can I help you draft how I'll be able to introduce myself and my experiences? I don't understand that. So do you want me to help you to draft a response to that question when it is asked during an interview? Or do you want me to help you to draft a supporting information answer? So that would determine what you want. That would depend on what you want. So if what's you say, let me answer that question first. So if that's what you're saying in terms of you want to know how you're going to explain, if they ask you, tell us about yourself, tell us about yourself. So that kind of question is an open-ended question. Okay, so that question would relate more to say, tell us about yourself. So you just give a brief history of your what's it called? A brief history of your career really. That's what they really want to know. What do you bring to the table? And in as much as you're talking about yourself and your career, you also need to have read the job description and the person specification. So you're linking yourself to that person's specification. So if they're asking about someone who has done wound care, you now say that as part of my role, as in we are to ask, tell us about yourself. As part of the roles that I've done in the past, I've managed wound care from start to finish in terms of ensuring that the dressing is done properly. So you're linking it directly to the job description and person specification. So that shows your depth. That kind of gives them, you're trying to build yourself as the perfect candidate of who they're actually looking for. So that's what it really means. You also need to make sure that when you're telling them about yourself, you're talking about the trust values. You're talking about the NHS values as well to ensure that it's links together. So they're in essence what they're trying to say is, tell me, are you the person we're looking for? Are you the one that we have been waiting for all this while to come and do this job? That's what they're really asking you when you say, tell us about yourself. Tell me how you fit into my team. Tell me how I built this person. I want to be able to put you in there to fit into that role. So that's what they're really asking you in that question of tell us about yourself. And what time am I coming on live tomorrow? So tomorrow is Thursday. I'm going to try and see if I can come on live tomorrow at 5:30, 6 o'clock. I'm hoping I'll try and put like a reminder or set a live thing up here and see if I can do like a live thing. Who gave you that? Where did you find it? Take one. And you're not allowed to eat upstairs. Okay. Sorry about that. When you have children and you're trying to multitask and do this live, they do tend to badge in. So apologies for that. Yeah. What I'm okay, I think I've answered that. So did I answer your question, Tochi Marianne? Like I think I've said previously in my other lives that I do offer one-to-one coaching, from interview prep to writing supporting statements to checking your supporting statement as well, so helping you to write the supporting statement. I've stopped writing it for people in silos because I want you to be able to be I want you to be able to do it yourself. So by the time we write two together, which is what I offer as part of my package, we'll write two supporting statements together. By the time we write two supporting statements together, by the third one, I would expect you to be conversant and be able to do that yourself. That's what I'm expecting. So teach a man to fish. That is my motto. In as much as I love money and I want to collect your money in that sense, I would also want you to be able to be self-reliant and be able to do it yourself. So that is what my goal is with regards to helping you. So I can help you check your applications. I can help you check your supporting statement. We can write the supporting statement together. We can do interview preps together. What else can we do? I think that's it. Coaching in terms of knowing what to say and ensuring that your NHS application is A plus to be able to be shortlisted for that role that you apply for. So I help people with doing from nursing jobs to administrative roles. So I think, irrespective of my role as HR, because I've been in a position to shortlist mental health nurses, healthcare assistants, administrators as well. I know what is actually good, what the recruiting manager wants to see in an application form. So I'm a very good asset to have in your corner. That's what it is. So yeah, I can always help with writing applications. I also said I have a YouTube channel where I talk about questions and answers, real life questions and answers of interviews that I've actually done. I kind of pick from different ones that I've done. It's like the ones from tomorrow. I think I'm going to do another video of a band 5 mental health nurse interview questions and answer. I'm going to upload that onto my channel in the next couple of weeks, because trying to edit does take time. I have like two in hand. I've done a band 3 interview question and answer and a band 2 interview question and answer. I've finished editing the band 2 question and answer. I'm hoping to put that up my channel sometime this week, and the band 3 would be coming up next week. So yeah, so that band 3 or the band 2 question can go for a um healthcare assistant or not. So yes, yeah. So depends on what you want to see and all that. Please let me know. Let me know. On YouTube as well, you guys are not asking questions. Ask questions, because I'm doing 2 lives at the same time. Because I'm trying to maximize work smarter in a way. Because I was doing YouTube live separately and I was doing TikTok live separately, and I'm trying to maximize my time in terms of, oh, let me do both of them together as well. Yeah. Yeah. So please let me know what you need in terms of questions, answers. I was meant to be, yeah. Does anyone have any questions? Yeah. Does anyone have any other questions with regards to me? Yeah. My YouTube channel is my YouTube channel. The link to my YouTube channel is on my profile here. So do well to do well to check me out. Do well to check me out. Does anyone have any questions? Any questions? If you want to reach out to me, my email address is. Oh, I keep always forgetting how to do this. My email address is comments. This is my email address. Um, I need to find it. Yeah, pin it. Can I pin it today? I don't think I can pin it today again. Yeah, it keeps not letting me pin the comments and all that. I don't know why. Yeah, it doesn't let me pin the comments. Mm. Just bear with me one moment. I think my neighbor is trying to come into my house. Hello, Ify.
Hello. Maybe they were inside that car.
Sorry about that. Yeah. So, um, um, Tochi Marianne, I understand how anxious you are. But you just need to ensure that you remain calm. You take your time. You can pick your words. Talk like this when you're explaining things to them, so you're not rushing. Don't rush. Don't rush. Sorry about that. Don't rush when you're speaking and all that. That would ensure that you're able to collect your thoughts properly. Okay, you'll be able to collect your thoughts properly. So don't rush. Question and answers. We can do another question and answer session for what's it called, for a band 5 interview. Let me see. How would you involve families and carers in a patient-centered care approach? So you say you would probably say, I would involve families where appropriate with patient's consent, recognizing that they can provide valuable insights to the patient needs, and they would have the right history about the patient, because sometimes the patient might not be able to remember properly their whole history. So having their family involved with their care would ensure that the full history has been collected properly, because sometimes as well the history of the patient does get lost when they're transferring from one center to the other. So, for example, during discharge planning, I would engage carers in discussions to ensure continuity of care and support at home, while also keeping the patient's wishes at the center of the process. So, if the patient doesn't want his family involved, of course, they're going to listen to the wishes of the patient and not just ignore what the patient has said, but making sure that the patient is at the center. So, with mental health, you need to ensure that the patient is the center of what you're talking about, of how you're treating them. So, ensuring that all their questions, all their answers go straight to you, and you need to be able to put that into consideration when you're answering the question. Okay? You'll be fine. Hi, BC. Oh my goodness, I haven't seen you like years and years. Oh my goodness. If you're still here, hello, BC. Oh my goodness, I haven't seen you like forever. Welcome. Oh my goodness. Hi, thanks, BC. It's been like forever. Oh my goodness. I just saw your name pop up on my thing and I'm like, wow. Small world in the TikTok universe. Welcome to my live. Yeah. Welcome, welcome, welcome. So, Marianne, sorry, Tochi Marianne, I think I've kind of shortened your name. I hope that has been much, much helpful in terms of when you're trying to sit in front of that interviewer to answer questions and all that. Yeah. So, yeah, thank you so much for the hearts. Thank you, thank you, thank you, thank you. I appreciate it. Thank you, thank you. I appreciate it so much. Okay. Yeah. Oh, thanks, BC. Thanks for liking the live. Oh, thanks for following as well. Appreciate it. So, does any other person have any more questions with regards to any interviews that they're having soon? Does anyone have any questions? Any questions with regards to any interview prep that they need it? So, this interview prep questions and answer that we're doing, I do that on a one-to-one basis with my clients. So this is like a snippet of what I kind of do, and kind of trying to prepare them to be what's called ready for their interviews. So we'll do like intensive 2 hour interview prep if you're going to be working with me for your interviews. We do 2 hours intensive prep where I ask you questions. We're going to do it over WhatsApp or MS Teams or Zoom, whichever one you prefer. And I'm going to be asking you questions that you're going to have to answer me. I'm not just going to be the one talking. In most cases, I don't even talk until I'm trying to explain to you what I've heard from you, and my notes of those questions and answers, and how best you need to be able to bring up the question from you getting a 1, a 2, or a 3 to getting a 4 and a 5 for answers when we're marking your interview. So when we're marking those interviews, we have like a score sheet, and in that score sheet we already have, because I'm not really in that area, they would have given me points of they would have told me, okay, I need to be able to hear stuff about um working with multidisciplinary team. You need to have said something to do with communication. You need to have said something to do with teamwork. You need to have said something to do with diversity, inclusion, or patient-centered care. There are some buzzwords that we need to be able to hear that you need to be saying as part of that interview. And if you're not saying it, then you are not going to score the right scores when we're marking that interview. So yeah. So that's another insight into interviewing as well. That although I'm not an interviewer, I although I'm not an interviewer, I do what's it called? I do understand what is needed. I'm just trying because I meant to actually start another live. Just bear with me one moment. Tips. I'm just trying to see my other live that I was meant to start that I scheduled. Okay, I think I'm going to have to leave this live and come back in. Just bear with me. Belinda. Decline, decline. God. Hi guys, sorry about that. I was trying to start the app, start the live again because there was something wrong with that one. Hello, welcome back. Sorry about that. Sorry. Welcome back. Welcome back. I'm just trying to get myself situated. Oh Lord, it's taking longer than I expected. Yeah, welcome back. Welcome back. Sorry about the abrupt end to the other live. Just trying to sort out some things on my live. Welcome. Just try and give me 1 minute. Tap menu, settings. Mm, trying to find something on my phone. Sorry about this. Up, oh Lord, where is it? How do I do it? A security blocker. What's our list? Many people, chats, notifications, storage, help centers. Tap link devices. I don't know where that is. Oh, oh Lord. Oh, where is it? Settings. Oh, I can't find it. So for later. Yeah. So sorry about this, guys. I'm just trying to do something on my phone and it's not letting me do it as much I would love to do. Oh Lord. Now it comes up. Um, yes. So yeah, just trying to.
Hello.
Hi Belinda, sorry.
That's all right.
I'm trying to multitask or triple task. I think that's the right word I'm trying to use.
Yeah.
So I'm actually on my TikTok live.
Oh, okay.
Yeah. And I'm on YouTube live at the same time. And I'm on call with you as well.
Oh dear.
Yeah. So we're gonna do like a interview prep, even if it's like one or two questions on
Mm,
live,
okay.
so that people can at least hear what you're saying. So if I'm going to try and increase the volume of my phone, of my laptop.
Okay. That's
Oh,
fine.
I'm reducing actually. I should
Do
be.
you have the job
Sorry?
of? Do you have the job specification for leads? I sent it to you, isn't it?
Let me look for it.
Because
What's the matter? What's the matter?
oh, I thought you were talking to someone.
No, no, no,
I said
no. I'm
because I
asking
sent
you.
it. I sent it to you. Let me do this.
Let me see if this is the right one. Because I
I've done
have.
this.
Yeah, I have it.
You have it, okay.
Yes.
All right, so that is it. And
Um.
today too, I went to Glassdoor to look for interview questions for Liz. I got some. Let me send
Okay.
it to you. But the person said it was a band 5 role.
Okay.
A band 5 role, and it was at the maternity. It wasn't at the what is it called? Transitional unit. Transitional unit is for the babies.
Okay.
So, but I'm just learning some of it from there, just in case they drop one or two of the questions. I'm good to go.
Okay.
Yeah.
Okay. Spell me. I'm just having a look. It's been so busy. I've been busy, busy, busy. I don't even know what I'm doing with my whole time.
Okay.
Yeah. Hold on. Where's that roll? Where is it? I think I've saved it yet. Um,
The Second Kara will soon be here. The one I told you about.
Yeah.
I can see she has come to park her car outside.
Ah,
Maybe
okay.
she's waiting till 15 or something and she enters.
Oh, okay.
So
So
when she comes,
we should be able to do at least one question.
okay.
Um, let's quickly do one question at least. Okay, so let's see. So the first question is, describe a time you had to take charge of a ward or a team during a busy and challenging period. Where's my book? Remember the
Okay.
star as we talked about before?
All right. Thank you.
Yeah.
All right. Thank you very much for the question and the opportunity to be interviewed this evening. As a midwife, taking complex challenges on a day-to-day basis, and especially having to deal with a very busy shift, has been one of the most times I have to deal with. What am I saying?
Describe a time you've had to take charge of a ward or team during a busy or challenging period.
All right, let me start off first. Thank you very
Okay.
much for the question and for the opportunity to be interviewed this evening. As a midwife, having to take charge in a challenging shift has been one of the many things I've had to deal with in my course of training as a midwife. A vivid example was when I worked in a very busy postnatal unit where unfortunately two senior staff called in ill due to unforeseen circumstances. It was my key responsibility as a midwife to ensure that I delegated tasks, prioritize high risk cases, and ensure both babies and mothers were fine. I then delegated tasks according to individuals' competency framework, ensure that the healthcare assistants who were confident enough were in charge of babies' observations as well as maternal observations, whilst I delegated complex situations to a competent junior midwife. To ensure accountability, I ensured that I supervised it and was also readily available for any questions. And this is something I bring on board at least teaching hospital. The values, which includes being fair, accountability, patient-centered care, as well as being accountable for the things we do to empower our patients. I made sure that I did a detailed documentation throughout, and it resulted in us being able to ensure the safety and the complex situations being attended to. In situations like this, I would make sure that the right escalation of care is made where I involve the multidisciplinary team when required. But in our case on that day, with the current staff I had and the proper delegation and leadership skills,
Yeah.
I should be able to handle the things around. And the mothers were happy able to explain in simple, plain language to them how things were, even though it was a busy day.
Yeah.
And this is something I bring on board, at least teaching hospital. And I believe I'll be a valuable member of the team from day one.
Okay.
Thank you.
That's very good. Like I said to you, although we don't want to do the star, although we
Mm-hmm.
want to do the star method, I've
Mm-hmm.
noticed that you've recently started jumping all over the place. And I did say that the star method, yes, is good. I mean, as in that, although that the star method is good and all that, you can still kind of waffle and go back and forth. But I'm
Mm-hmm.
noticing now that you're not really doing the star method anymore. That you would finish your answer, you will now go back again to reconfirm
Mm-hmm.
your answer, which is good. But I want it to be a bit tighter in terms of, because I've already started writing the documentation, the escalation, and all that, working together, the patient centered care and
Mm-hmm.
multidisciplinary. I've already started putting that to one side. I'm
Mm-hmm.
sorry, let me just tell you, if you're joining this live is just a real life example of a coaching session I'm having with one of my clients. Okay. So as we're saying, so with that, I still want you to do the I still want you to do the star method. I would prefer for you to do the star method because it makes it succinct and very, very streamlined in terms of
Mm-hmm.
how the answer to the question is.
Okay.
So although you put all the points in there, it was all over the
Mm-hmm.
place.
Okay.
So I want it to be a bit drawn in properly so that when we're writing,
Mm-hmm.
I'm putting a space in there. Okay, I'm now putting
Mm-hmm.
writing up there prioritized. I'm now putting up there um ensure accountability. Then you talked about your supervision, fair treatment. Then you talked about documentation at the end, which documentation should have been at the top as well.
Mm-hmm.
The yeah. So I think I want it to be a bit more,
Well
yeah,
structured.
well structured.
Okay. Let me
Even
go
though this is
have a
still
second
fine,
try.
I know, even though this is still
Mm-hmm.
fine and they're getting all the
Mm-hmm.
information they want to get, but I want them to start thinking of you as being properly thorough in terms of your methodology of doing the in terms of doing the task that have been assigned to you.
Okay.
Yeah. So
Okay.
do you want to go again? So the question is,
Yes.
describe a time you had to take it rather describe a time you've had to take charge of a ward or a team during a busy and challenging period.
Thank you very much for the question, and I'm pleased to be here to be interviewed this evening. As a midwife, having to take charge in a busy shift has been one of my key responsibilities I do, and a lot has happened during my phase of being a midwife with over 4 years' experience. I can remember vividly on one postnatal shift. We were short staffed due to unforeseen circumstances. Two senior midwives called in sick, and it was my key responsibility to step out as the leader to ensure that the 7 cases we had at the ward, which include complex cases, were seen to. At the postnatal shift, me being the only senior midwife with two junior midwives and healthcare assistants, was my key responsibility to ensure that both mothers and babies at the ward were well taken care of, whilst ensuring good clinical safety techniques according to the Nursing Health Organization guidelines. I first ensured that I prioritized care and then delegated tasks according to individual competency framework. So, with regards to delegating tasks, I ensure that the healthcare assistants within their framework and competency were assigned to check maternal observations. Whilst with the complex cases, I delegated the task to a junior midwife. And to ensure accountability, I ensured that I oversee whatever she was doing, whilst ensuring that a thorough handover were done using the situation background assessment and recommendation.
Good.
I then also ensured that key documentation was done thoroughly to also help with continuity of care, as well as a legal document when needed. All during all this time, to ensure that I'm a good leader, I was readily accessible to ensure that if there's any questions, they will come to me, and also involve the multidisciplinary team in complex cases when needed. At the end of the shift, we were able to foresee all complex situations with the help of the multidisciplinary team involvement, and
Good.
also keeping the morale within my group.
Good.
And this is something I bring on board at least teaching hospital. Being
Oh,
able to give fair care, patient centered care at heart, collaboration with my colleagues,
yeah.
and ensuring they are empowered throughout is something I bring on board.
So much better.
I,
Oh, you're still
at,
talking.
the,
Apologies. Sorry. Continue.
at, the, at the end of the day, I learned that having to collaborate with colleagues
Yeah.
and also escalation of care,
Yeah.
it's a key principle in helping deal with patient-centered care to improve fair inclusivity and diversity in the healthcare. And in transitional units at least, this is something I bring on board. And I know I'll be a great and valuable member of the team from day one.
Uh-huh.
Thank you.
So much better. The first answer, I probably would have given you a 2.5 for your scoring. And this one I'll probably give you 3.5 for the score because you
Mm,
were still all over the place. You talked about documentation. You didn't talk about if there was any issues within that team, or because you're short staffed, you're already short staffed. You didn't talk about um, trying to get more staff in terms of
mhm,
trying to speak to any other team, or because of the sensitive nature of your team, you need to try and bring in more staff. So you didn't talk about speaking to bank or speaking to any other person that could help you guys find more workers to come and work with you guys in that team. So you didn't talk about that. You talked about prioritization, care, still teaching, still mentoring at the same time, overseeing the behaviors and all that. But I think where you fell short in this answer was the fact that you didn't talk about trying to bring in more care, more staff to try and come and help you. And your escalation
Okay,
point as
so
well. I don't think you talked about escalating to seniors.
so I talked about involving the multidisciplinary team.
Yeah,
So the
but
multidisciplinary team comes in to help. So it will fill in the gap of the extra stuff you're talking about. And it's about the same escalation. So you escalate to the MDT
yeah.
and then they come to help the situation at hand.
Yeah, but that's only if a situation occurs. But at the moment, you're already having you had people or seven babies that you needed to look after, and when you're in that kind of
Mm-hmm.
ward, you need more help. But the multidisciplinary team would not come in until you request them to come in. So really,
Mm-hmm.
you're on your own until you call them
Mm-hmm.
in. So I think it's
Mm-hmm.
just being aware of getting them in immediately than not what's it called than than calling them when you need them. So that this is a typical for people watching. This is a typical question for a midwife working in a busy ward, and this is a the transitional team. So we're just going through questions that would likely happen, that would likely occur. This is going to be for a band six midwife. So just in case you're wondering what we're doing in this live, that's what we're doing in this live. So for people that are just joining and just trying to kind of hear how we kind of mark and how the interview panel marks and how what I would expect to hear from an answer that I ask you. So that one I'll probably give you truthfully like a 3.5, a 3.5 for your answer. The first time you spoke, I'll probably give you 2.5 for that answer. So we need
Okay.
you need to ensure that you're practicing, like I said to you, you're practicing and putting all the right words, putting all the right keywords in place.
Mm-hmm.
Okay, we'll do one more quickly before I have to leave as
Okay.
well. Tell me a time you had to respond quickly in an obstetric emergency.
All right, thank you very much for the question. As a midwife, having to respond quickly to obstetric emergency is one of the key responsibilities I do on a day-to-day basis. A very vivid example of when I had to escalate concerning an obstetric emergency was when a woman who was 34 weeks came with complaints of high blood pressure and frontal headache, which indicated preeclampsia. It was my key responsibility as a midwife to ensure the well being of both mother and baby, whilst ensuring that safe clinical care is being given according to the hospital guidelines. I immediately called for help by pressing the emergency buzzer, informed the multidisciplinary team, which includes the obstetrician consultant, the anesthetist, the other midwives, and then I immediately ensured that the woman was checking her maternal observations vividly, especially the blood pressure, and then administer prescribed antihypertensive such as nifedipine orally, and this helps to reduce the blood pressure. Whilst because baby was in utero, I delegated task force her CTG to be conducted, a continuous one to help also protect the baby in utero. When the team arrived, a blood sample was taken, and as a Vance's midwife, I delegated task for a blood sample to be taken for full blood counts, liver and kidney function test, and also urine sample taken to know the protein level in urine. Because it was a dangerous sign and she had a possible time to fit, because preeclampsia and eclampsia is just a few minutes away. With the consultant's advice, magnesium sulfate was administered according to the trust guidelines, whilst we continue monitoring maternal observation every 15 minutes till it reduced to 135 over 85 millimole per mercury. Baby's heart rate was stabilized, and this is something I bring on board. Teamwork, collaboration, and fair care, as well as patient centered care, and this resulted in the woman also having to relax without being very anxious. A detailed documentation was done afterwards, according to the trust guidelines. And as a midwife, I reflected on this is knowing when to escalate on time, involvement of the multidisciplinary team at the right point in time, and also doing everything possible to ensure the safety and the well-being of both mother and baby. And one of the important values of Lee's teaching
Mm,
hospital is patient-centered care. And this is exactly what I bring on board. And I know that I'll be a valuable member of the team from day one. Thank you very much.
very, very good. I think you were more structured in this answer when you gave it. It touched so many aspects of what I was expecting to be the answer
Mm-hmm.
to this question.
Mm-hmm.
Yeah, it's so much better than I think what happens with you is when we start the prep session, you're always a bit kind of nervous at first, but when we get into it properly, you now start to kind of follow the star method. Yeah, yeah, it's very
Yeah.
good. This is another solid 3.5 score.
Mm.
It's another solid 3.5 score because it touched all about all the collaborative work, teamwork, and escalation, the patient centered care, putting them, letting her know. I don't think you touched about informing the mother as to what was going on. You didn't touch about that, letting her know what was going on. Even though you're talking about the patient centered care, you need to also inform the mom as well as to what's going on and keep her abreast because at this point she'll be probably be scared and she needs to know what's going on. Trying to find if because she's 34 weeks now, chances of her being going into labor and being asked based on the results of the blood tests and all that, being asked to deliver that baby were there. So you need to give her all the options that were available to her. So you didn't talk about it. Hence the reason why I'm giving you like a 3.5.
Okay.
I did say that although I keep saying it to you that although I don't have a clinical background, luckily I've had
Mm-hmm.
children, but and
Mm-hmm.
also luckily I've sat on different panels. So I know the kind of things that we're expecting to hear from the people that are sitting at the other end of that table. So yeah, so this is another 3.5 answer because of that fact that you're not talking about the mom and keeping her abreast of what's going on in that whole chaotic time because she's gonna be scared.
Mm.
Okay. So
Yeah.
that's really good. So that's really good. We can continue later because you did say the lady was gonna want to change shift.
She, she she she's still not here, so
Mm,
I'll take the opportunity. When she's coming, I'll let you.
okay. Okay, I think the reason why I was saying that was because I needed to go and pick up my son. I think
Okay, that's fine. Then when you come back,
yeah,
when you come back, yeah.
yeah. So
All right. Thank
start getting ready. I'm going to have more questions for you. I have
you.
about
Okay.
10 questions that we're going to go through
Okay.
tonight.
All right.
So
Thank you very
we've only
much.
done
All
about
right.
less than 30 minutes already. So know that I
Yeah.
need it on fire. You
I
know how we
will. I'm
do.
ready.
You know
I'm
how we
ready
do.
for you.
Okay, good.
Yeah.
You know how we do.
Oh,
We'll be fine.
yeah.
I believe the first one was just a test. This one,
Oh dear. Hmm.
we'll fine. We'll talk about it properly when I get off
Yeah.
live and all
Yeah.
that.
All right. Thank
Okay?
you. All
Okay,
right.
I'll talk to you soon.
Sure.
Take
Thank
care.
you.
Yeah, bye.
You too. Bye bye.
Yeah, so that was just a brief example of what the kind of thing I do as part of my coaching session. I go through questions and answers with my clients and kind of give them pointers as to where the gaps are in their interview because there is something for you to actually um there is something in terms of you answering the question. And there's also something for you to be able to know where the gaps are in your answers. So you need to ensure that when you're answering the questions, you're covering all the gaps. It's only someone that sits on that panel or someone that has experience in interviewing that would be able to let you know where all the gaps are in your answers. So in as much as she was saying the right things, she was still having a bit of gap, and that's the difference. If we were scoring over five, those scores that I was giving, I was over five, and she knows that. If we were scoring over five, if I was marking, those are the scores I'll be giving her between the three, two and a half, two, and 3.5 would probably be the maximum I would give her. But we're still going to go through more questions. I think this is what I realized with her is that when I first start asking other questions, she's kind of she's still all over the place. I'm like when I asked her the first time, the star was just out of the window. But when I now pulled her back and I called and I corrected her in terms of her thinking, in terms of her articulation, in terms of her reasoning as to how best to answer that question, she was able to draw it back and then be able to answer the questions properly. I hope that little session that I've given, Tochi Marianne, I hope that you've seen the kind of thing that I do with regards to interviewing prep for people that work with me personally. So I would do that mostly, apart from the fact that I'm on TikTok Live, I mostly do face to face interview sessions that we actually, you would do like either a Zoom meeting, a MS Teams, or a WhatsApp video call. So I can see your eyes. So you're looking at me when you're answering that question. I put you in that interview mode for you to be able to answer. You're not talking to me as my client, you're talking to me as the person that is interviewing for you to be able to get that role. So you're sitting in that interview space that you're going to go for that interview and be confident when you're answering those questions, because by the time you practice the same answer, these are the questions that normally come out. In as much as I don't have direct direct interview or direct interviewing for a midwife, I know what is expected. I know what we want to hear during those interviews. So the answers you're giving me has to align with what I've written down as my point of I need to take this off. You've answered it, you've said this, you've said this, you've said this, and all that. Yes. So yeah, I need to go now. Thank you so much for joining the live. And if you do have any questions, send me a DM, send me a message. My email address is this for people that are asking or not asking that want to connect with me. I have a lot of phone calls I need to make today because I need to reach out to a couple of people that have reached out to me on here that wants to work with me. So I need to reach out to them and make those phone calls today. But yes, do well to go on my YouTube channel and watch some videos about interviewing and questions and answers, supporting statement, how to write the perfect supporting statement. I'll be bringing out more videos in terms of band twos, band threes, band fours, band fives, band six. I'll be bringing out more interview questions and answers over the next couple of weeks. I'm really going to be bombarding my YouTube channel with interview questions and answers prep so that you can be able to ace those interviews when you're sitting in front of the panel. I'm going to give you as much information, as much questions and answers that would help you ace those questions when you're being asked during that interview. So if you do want to reach out to me, that's my email address, the human resources playbook at gmail.com. That's my email address. So, and if you can't get that email address, you can always reach out to me on here on through sending me a DM or just sending me a message on here, and I would do well to respond to you. So please, please, please like this live, share this live, and I will try and come on tomorrow as well to just ensure that I reach out to everyone as much as possible and give you tips and tricks of how best to answer questions and answers during an interview. In as much as I'm doing it here, I'm not going to give you 100%. I'll probably be giving you 20%. But that's why I wanted to stop that interview prep for my client, because I've done like two questions with her, and you can see this is kind of thing I'm able to do with you. So I wouldn't do the whole interview prep with my clients on here. I would only do a couple of it, or maybe 30 minutes, like I wanted to just do 30 minutes, so you can kind of see how my reasoning and how people talk during interviews. So it's not about you just talking, it's about you saying the right things and ensuring that we are answering the questions properly. Okay? So until tomorrow, I'll try and definitely come back tomorrow or even maybe later on tonight to kind of go through, because probably going to speak to her again. Not even probably, I'm going to speak to her again because our interview is coming up. And she's already paid for the sessions with me. So she really wants to get the job, and I really want her to get the job. I'm quite invested in her. She's she's like my baby and all that. So I really wanted to get the job. So I'm very invested in her, and she's already paid for our sessions. So that's another thing that I do: one-to-one coaching sessions for people that want to ace their interviews. So until next time, when I do bring you more tips, more tricks of answering questions, I would be bringing next time, probably, not even probably, I will be doing more questions and answers of interviews. I'll be doing more questions and answers of interviews on here as well. Okay. So thank you so much for coming on to watch this live. I really appreciate it. I'm really sorry about all the my breaks and intermissions that I was doing here and there. But yeah, I really appreciate you coming on, and I will speak to you all soon and see you all soon. Thank you and have a good day. I really appreciate the like Mercy Temi. I really appreciate it. And everyone that has dropped a like, everyone that has dropped a follow, thank you so much. Please watch my videos on YouTube. The link to my YouTube channel is on here. And if you want a consultancy session with me, send me a DM, send me a message on here, on TikTok, on YouTube, and I would answer you. And I will send me an email. I would definitely respond to you. Until next time, thank you everybody. Bye.